Do you have a dachshund and have questions on topics like training and nutrition? Do you want a dachshund and need help locating a breeder or finding a great rescue? Did you have a dachshund growing up and want to share some funny or heartwarming stories? Then you're in the right place. Welcome to the Wiener Dog Lover Podcast, the place to be for all things dachshund. Welcome back, Wiener Dog Lovers. Now, I don't have kids to send back to school, but it is September and it does bring cooler mornings in Calgary. We walk really early, so it's dark on most of our walks at this time. And I often have to hunt down baby Wiener as he's a red smooth and he doesn't really like the cold. So he takes a little bit more persuading. As well as Julian, he's 11 and he's never really enjoyed walking. So I got him a canine sport sack and he absolutely loves it. And what I usually do is I put him in it at the beginning of our walk and then take him out about halfway through the walk so that he still gets exercise, but he doesn't get sore and tired. And that leads me right into today's podcast. Today's podcast is about pain management. My interview today is with Dr. Deirdre Chiaramonte. She works as the veterinarian on the Assisi Loop, and this product is a really non-invasive pain management tool that can be used at home with our dachshunds, and it can help with surgery recovery, pain from IVDD, or muscle issues. Dr. Deirdre really makes the science easy to understand and gives us some great examples of how the Assisi Loop can benefit your dachshund. Let's get into it. Dr. Deirdre, thank you very much for speaking with me today. Very interested in the Assisi Loop as a dachshund owner, a wiener dog lover. I've unfortunately had IVDD affect one of my mom's dogs years ago and would have loved to have had a technology such as this. Quite possibly the Assisi Loop could be a lifesaver for some of our dachshunds. Maybe you could just get started with explaining to us what the Assisi Loop is and maybe your involvement with it.
Sure. The Assisi Loop is actually called pulsed electromagnetic field therapy. Some people confuse it with magnetic field therapy, but PEMF, the important part is the pulsing electromagnetic fields. And they just encompass an immense spectrum, making it almost impossible to assess among all the different devices that you can find on the internet today. But specifically in our case, the Assisi Loop is pulsed electromagnetic field therapy, abbreviated because that is a mouthful as PEMF. And my involvement with the company actually started before Assisi was a full-blown company. I worked at a rehabilitation facility in New York City and lucky to have all of the best equipment there was possible and medical devices. And the Loop was the last one that crossed my doorway, and I was able to work with it. And it made a difference in my rehabilitation patients. And after leaving that job, I began consulting for the newly formed Assisi Animal Health company. And my first job was actually quite interesting for them. I got to call all of the veterinarians across the United States that had been using the Assisi Loop for years and years through its prior company, and to listen to all of the success stories that they had really made me get excited about this new field of treatment options available for pets today.
Yeah, that would be pretty amazing. All right. So then what exactly is the technology behind the product?
So we're just going to go back into a little bit into history.
Okay.
If you can remember, I certainly can, growing up in my, working in my dad's orthopedic office. Back in the 70s, there was a technology that came out, the bone growth stimulator. The premise of that was that you would actually implant electrodes into two opposite sides of bone that had broken and they were not able to heal. And then they would drive current across them so they can actually get the bone to heal. The gentleman that was using a lot of these procedures was flying on a plane to California, and Arthur Pilla, who was an electrochemist, was also traveling to California, and they struck up a conversation, both realizing that they had the same passion for healing. And what Arthur Pilla actually proposed was that instead of actually implanting electrodes into tissue, that they actually just pulse the signal from the outside. So that was Arthur's contribution. And when they got back from their respective trips, they worked in a lab together and actually created the bone growth stimulator, what was just applied to the outside of someone's leg and could deliver these electromagnetic fields to heal tissue. Now, as fantastic as that was, since they didn't really have a lot of research behind it, the signal that they actually generated was not as effective as today's Assisi Loop. So Arthur, over the next several decades, perfected the technology and the signal and was able to finally understand a lot of the basic science behind what he was trying to do, and that was enhance nitric oxide in the body, which is very important for healing body tissues.
Perfect. Then he went on to create the Assisi Loop from there.
Yeah.
Was he a scientist? Is that Arthur Pila? Was that what he did? Great.
Arthur Pila was an electrochemist.
Oh, okay.
He was trained in Paris, and he was able to work alongside surgeons, orthopedic surgeons, plastic surgeons, using his technology. And from the prior company up through Assisi, was really able to fine-tune and know exactly what he was doing, with the outcome of this device.
So how long has the actual loop been in use?
Oh, goodness. Probably almost 20 years.
Oh, wow. So quite some time.
Yes, and that is the beauty also of having a very good science background and the same people involved in sort of all of the research is that you have historical knowledge. You're able to perfect what you maybe weren't as good as in the beginning. But the other wonderful thing, looking back for PEMF and the Assisi Loop in particular, know that at this point there are thousands and thousands of patients being treated without side effects.
That's very important, especially when we're talking about IVDD. So many dachshunds are on various other kinds of treatments. So having one other pain relief that doesn't have any sort of side effect is really impressive. And as well, there's no contraindication when using the loop with other kinds of therapies. That's correct as well, right?
There are no contraindications for using it with other current modalities used today. The only caveat to that is some of the other devices, like laser, which is very popular in treating our veterinary patients, and in particular IVDD, they do both enhance nitric oxide. So we say to separate them by about 2 hours.
Now, so what exactly is the loop used for? So if you were promoting it to either a vet or to a pet owner, what would be the highlights of, in fact, using the loop? Historically,
we have used the loop for, and just a very oversimplification, was any condition that ends in itis, any inflammatory condition, because it is best used in inflammatory conditions. And by decreasing the inflammation, you decrease pain. So pretty much everything, I can't think of reasons not to use the loop in very common things, what I see every day in practice: osteoarthritis pain, dachshunds with intervertebral disc disease, dogs with neck pain. And then when clinicians get used to the technology, and these are the stories that I love, doing things that are a little different and not often thought of. So a cat with pancreatitis and inflammatory bowel disease, or a cat with, another common one is feline stomatitis, a very painful dental condition. And it's really because it targets inflammation. Anywhere where there's inflammation in the body, the loop can be helpful.
Then as soon as a dog or a cat that's diagnosed with any sort of inflammation, it can be used immediately.
Correct.
Have we seen at all any kind of decrease? So if there's a pet that's been on, whether it's a pain medication or an anti-inflammatory, have they seen a decrease in having to use some of these medications by having used the loop?
Absolutely. If you go onto the Assisi website on the blog section and just kind of scroll, especially in the arthritis, cases with arthritis, absolutely owners note that they can decrease the amount of non-steroidal. And I love non-steroidals. They are absolutely appropriate for, many inflammatory conditions in our veterinary patients. But sometimes dogs and cats cannot tolerate them. Cats, whole other subject on what we have available for them. But just, there have been some stories where, dogs cannot tolerate nonsteroidals. And there's a couple stories on our blog as well that point to dogs that get horrible gastrointestinal signs from being on nonsteroidals. They just can't tolerate them, life-threatening side effect. And so that's when, veterinarians really appreciate using the loop to treat those situations. And in one of our recently, it's going to be published in just 2 months, one of the research studies showed and actually mimicked the human studies where dogs using the loop took about half as much pain medication than the dogs not treated with the loop. And again, this was also an intervertebral disc disease study.
That's the one done at the University of Carolina?
No, this is a second one done at the Animal Medical Center in New York City.
Oh, okay. And is it similar to the one then done in North Carolina?
Is very similar. The differences between the two studies was that the severity of the dogs affected in the North Carolina study, those were the complete grade 5, the worst of the worst dogs. And the ones in New York City were a lower grade. But it's pretty amazing. We don't have that many studies that show, that using a medical device can decrease opioids by almost half.
So much better for the body, for especially long term.
Not only, and yes, that primarily is the best, but second, in today's opioid crisis, some of our medications that are accessible to veterinarians are becoming more difficult to obtain. The regulatory issues and control issues with them make it just more labor intensive. So if we can find a non-addicting, excellent pain relief device, all the better for all of our patients.
Absolutely. There are 2 different types of loops. Having looked on your, looked at it on the website and researched some of the product, there are 2 different types. Can you maybe explain what the 2 different types of loops are? I
think you're referring to the automatic versus the manual.
Yeah.
The manual loop is a loop that, so we'll just talk about how we treat with the loop.
Okay.
And what we were using in the studies.
Okay.
And again, the nice thing is we got to borrow from the humans. The humans were the guinea pigs for the dogs. So in the human realm, much of the research was done on women that had mastectomies and tram flap and double-blind, placebo-controlled studies where the loop was incorporated right into the bandage. That's one of the fascinating things. Again, since we're pulsing from the outside, we can go through bandage material, etc. So women using the active form of the loop had 50% less pain based on visual analog pain scores. They had less edema formed in their wounds. They measured some biomarkers within the edema, and they had lower amounts. And then these women also had requested, they had to actually ask for their pain medications, and they requested 50% less. So they had less pain on less medication. Using that protocol, going to the North Carolina State protocol, when we talked about the intervertebral disc disease, we used that same concept. So we took the automatic loop, it's called AutoCycle, and that protocol is when there's a very acute inflammatory process. So we're thinking trauma or post-surgical. There's a lot of inflammation right there.
Sure. The
loop will turn itself on for 15 minutes, treat, and then turn itself off and continue to cycle every 2 hours for the lifespan of that loop. So fantastic, especially for these dogs with intervertebral disc disease. In the North Carolina study, they wore the wearable and had the loop velcroed right to it. So it was right in place over the incision where the injury was. And then following also some human work and some osteoarthritis work we've done, then they went down to getting treated just a few times a day. So in that case, you'd use the manual loop. Once you turn the loop on, it works for 15 minutes and turns itself off. And it doesn't turn itself back on until you do. In acute inflammatory conditions, we like to use the AutoCycle loop because when there's more inflammation, the loop has a better chance to decrease the inflammation. And in sort of long-standing chronic conditions like arthritis, there it's probably better just to start with a lower amount of treatment. It's not going to hurt to use the auto cycle, but it takes a little bit longer to get into some of these more insidious degenerative processes to make them start to feel some pain relief.
And to respond. Okay, so that makes sense. You have now a new product with the Loop that has the Assisi Loop lounge that they have with, I believe it's called the Sleepypod. What are the benefits of the lounge over just having the Loop?
Well, it depends. One of the, it is a 15-minute treatment period. And some dogs and cats are wiggly. They don't want to stay still. They're active. They're feeling good. They want to move. And you're trying to target sometimes, instead of a back, you're trying to target a knee. And it's hard to keep, a loop around a moving dog leg, especially since they're feeling better. The pad and the Sleepypod together act as a place where you can the pad holds loops inside of it. And so you can just put the animal inside the Sleepypod and close them in there. It's a very gorgeous carrier. And so then the animal can get their 15 minutes of treatment period, and you know that they're getting it absolutely, and they're not going to be outside the treatment field. So that's really great. Also, especially in cats, difficult to hold still, and other, exotics, ferrets, birds, you name it.
Never would have thought of a bird, but that's awesome.
It's wonderful to use an exotic.
Sounds like an amazing product. I can't imagine not having access to it. How do people go about getting access to the Assisi Loop?
Currently, now that we have research to back up what we've been saying, it's becoming much more of a common household or veterinary hold name. And at conferences, we have definite KOLs, key opinion leaders, who lecture and incorporate the Loop into their treatment plans. So a lot of veterinarians now know about it. For the veterinarians that don't know about it, we have information on our website. So you can go onto our website and actually request to have information sent to your veterinarian. I am willing to talk to anybody that wants to hear about the Loop, just because it is a fascinating, just a really neat device that works and doesn't need to be solo therapy. It absolutely can be used with all other therapies. And treating dogs and cats for a long time with arthritis. And also, once you have a dachshund with one disc space, a lot of times later on, they will have a second disc space or third affected, or dogs with cruciate ligaments. Once they rupture one, usually 50% chance they're going to rupture the other one. And that the Loop is fantastic for sending the patient home with it. There's not that many treatment options that the owner can do at home. And that really is where we elevate what we can do for our patients instead of having them to come back to the office. I love laser therapy. I love ultrasounds. I love TENS units. They're all appropriate, but they're all really in-office devices. And it would be hard for me to ask my patients to come and see me every day.
Whereas the Loop you can use every day. That's perfect. Now, what is kind of the lifespan of one of the Loops? Does it recharge? Is it battery operated? How does it work that way?
So because it was actually created for the human market, and there are many with the FDA, humans do not share electrodes or things that touch the skin. So it is made to be responsibly recycled. Within that, also, the nice thing is because it's battery operated, it can go with you anywhere. So agility dogs, a lot of handlers are taking the Loop, obviously, on the road with them. It's not that big. It's not that heavy. Even pre-treating before they go into the ring. The batteries, what we can guarantee now is a minimum of 150 treatments in the manual Loop. And because of the programming involved in the auto cycle Loop, it's probably about 100 treatments. Now, that's just the minimum of what we guarantee. There are some Loops that are going longer than that, especially if it's well cared for, not in extreme cold temperature or heat. For a device that does what it does, I'm happy with the configuration of, what we can do. One of the things that we were sort of thinking about was, if we made the batteries rechargeable, in all honesty, taking a piece of equipment and having anybody be able to crack it open where it's a very small area where the batteries are and all the connectivity is to generate the electromagnetic field. I probably couldn't guarantee after you crack that open a couple times, change the batteries, that the wires would come undone or whatever. And we have to guarantee that every single time that device gets turned on, the same electromagnetic wave comes out of there to prevent and treat inflammation. For me, I think it's okay that this one's not rechargeable or recyclable. The Loop Lounge, those are rechargeable.
How does a person get a hold of a Loop? Can we order them from online? How does that process work?
If your veterinarian is familiar with the Loop, the veterinarian can order it, and they either have them in stock or can order from us and have us send to the client. If the client does the research and is interested and their veterinarian does not know about the Loop, then they contact us and we can contact the veterinarian to give them information as to why they would want to prescribe the Loop. It is veterinary prescription just because we never want to cut the veterinarian out. These are their patients, and there should always be someone talking with the client about how to use the Loop.
If someone is looking to get a hold of it, then their best bet is to speak with the veterinarian about it. And then hopefully if the veterinarian is on board, they can prescribe it. I was reading through one of your information. Do some of the pet insurance cover the Loop?
Yeah, and that's, we were just doing some research and we're like, wow, it's pretty amazing that insurance companies, depending on your plan, do cover the Loop. But again, every insurance plan is different, so you just have to look at what your plan is and what level. But yes.
So now, is there anything that we haven't covered about the Loop that you want to make sure that gets out there so that people are really aware of it before we finish up?
We talked a lot about sort of the acute inflammatory and, post-surgical. And I really found, unfortunately, when a sort of newish technology comes to light and it's not well understood, that people tend to use it on the crazy one-off things that nothing else has worked on. And that's actually been some of our greatest successes, is what nothing else has worked on, or just the challenge of using it. There's a story on our website about a little cockatiel. It was very, very old, late 20s. And he had long since stopped flying, and so he would spend all this time perching, and he had a sore foot, and the veterinarian suspected arthritis, and so they decided to do a couple Loop treatments, and within a couple Loop treatments, not only did his leg lameness go away, but the bird started flying again, which he hadn't done in years. I kind of like these one-off stories that really warm the heart and give you the tingly feeling. And in the Dachshunds especially, we talked a lot about post-op, but it's funny, I like using the Loop in pre-op, post-op, and no-op cases. So a lot of these dogs, I think especially if you have a dachshund that had one disc surgery, that dog should leave the hospital with the Loop and continue to use the Loop for the rest of its life. And I also think that sending a safe, effective medical device home with a client is just amazing. Really adds another level for what we can do for our patients.
Absolutely. With IVDD, it's such a challenge. And like you said, especially if you can do something that's non-invasive, that allows for them to heal faster and to feel less pain. I'd like to ask one last question, and I guess is if there's something that you could share that you've learned from your own pet.
Oh, goodness. Well, I think just because I'm on the road a lot for Assisi, I used to have a golden retriever and then always a sidekick, poodle type cross. But right now I'm down to one blue Persian cat, and his brother, who unfortunately passed away last summer, was on a host of daily medications for everything that ailed him. And it was a challenge every day to go pill that cat. It's funny, in the exam room, we have to be authoritative and tell the owner, here, your cat or your dog has this. Dogs are usually 90% much easier to give daily medication to, right? Yep. It wasn't a treat. And cats are they're not going to fall for it. It was one of those, moments where the cat was having difficulty jumping on the counter to get the food. So my husband went to put the food down on the floor and said, I think he's getting a little too old to jump on the counter. And I said, no, wait, stop. If we do that and change, then he's never going to challenge those muscles again. We're going to let him sort of, get old and lose all that muscle strength. That day, I started the Loop, and within 24 hours, just about 2 or 3 Loop treatments, he was able to jump back on a counter again. And so I was able to use the loop on him. I put it right underneath his where he slept on the couch spot, and was able to decrease his non-steroidals, which is fabulous because then I don't worry about, liver or kidneys. And obviously, for him, I could check that he could jump every day onto the counters. I love this product, even though the acute stuff is really great. The long chronic cases, I think, can just be so life-changing. And learning that from my own cat, practicing what I preach.
So true. We forget, well, not forget, but we often, when we're dealing with things such as you being working with the loop at all times, you sometimes forget to actually put it into practice in your own life. A lot of people find that they do that same thing. So just kind of reminding yourself that, oh, right, this is an amazing product.
Yes.
Yeah.
And he loved sitting on that loop. They can't feel it. It's just, I always kind of think with every case now, what can I help here? What can I help here? My pet taught me to look right in my own arsenal.
Yeah, exactly. Again, with IVDD, pain is one of the hardest things that a pet owner has to deal with. And I know a lot of dachshund owners, when they start to look at the treatment plan and options, and they see their dog suffering in pain, that's the hardest thing to deal with. And so having a product like this that they could use at home because sometimes things happen, overnight when they can't get to emergency clinics. And if at the very least they could use the loop for a little bit of help until they can get back to see their vet, that I think would be a game changer and very comforting for a dachshund owner for sure.
It's wonderful. And I love working with it.
Could you just give again the website for Assisi Health so that people can reach out if they want to get more information on it, so that they can either look into it for themselves or be able to direct their veterinarian to it?
I work for Assisi Animal Health, and the website is assisianimalhealth.com. And there is a section for clients and a section for veterinarians who are interested in learning more about the loop. I love reading the blog, the cases that we've treated over the years, just some amazing stories. If anybody wants any additional information, just the email address is on the website, but we are a very responsive team, small team, but mighty, and love to educate about the loop and the PEMF.
Perfect. Small team and mighty, kind of just like a dachshund. All right. I think that we've got everything. So thank you so much for speaking with us today. Then I really think that getting this out there will really help a lot of dachshunds. So I'm very excited to put this interview up and to share it with some of our wiener dog lovers. So thank you again. I really enjoyed today's interview. We all know how stressful it can be to have a pet that's in pain and not be able to do anything about it. So this tool is really something that I'm looking forward to hearing about. If you have any of the loops, I would love to hear how it's working for you and your Dachshund. This weekend, I am doing 2 events for our little Dachshunds, and they are local to Calgary, September 14th and 15th of 2019, in case you're listening to this at a later date. But I will be attending 2 events, and the first one is called Circle Carnival. It's a local festival, and they put on the dachshund races, and they donate to our local rescue, Alberta Dachshund Rescue, and we'll be there doing the dachshund races and also a costume contest. And then the second event is our local Wienerpalooza that's held every year, and I will be there as well, taking pictures and meeting people and watching the races. And if you're there, if you're going to be there at either one of them, send me a direct message through Instagram, and maybe we can chat while we're there and meet in person. If you have a wiener dog story, an event, or a topic you'd like to see us cover, send an email, bark@wienerdoglover.com. Follow us on Instagram, wiener_dog_lover_, or Twitter @lovingwienerdog, or find us on Facebook, Wiener Dog Lover. Never miss an episode. Head on over to wherever you listen to podcasts and subscribe, and you'll be notified every time we put out a new podcast. I'd also be grateful if you would leave us a review. Until next time, Wiener Dog Lovers, this is Lori, Sheba, and the Wieners signing off.